Hello, everyone. Welcome to the webinar, Pollution and Global Health Impact of Plastic Production. I am Rocío Cortés from the Pontifical Catholic University of Chile, and I will be the moderator for the webinar today. This webinar is the first of a series of 3 webinars that will take place during this year under the title Integral Ecology and the Future of the Planet, Interdisciplinary Conversations. This webinar is organized by the Strategic Alliance of Catholic Research Universities, SACRU, which is composed of 8 institutions: the Catholic University of Australia, Boston College, US, the Pontifical Catholic University of Chile, the Pontifical Catholic University of Rio, Brazil, Sofia University, Japan, the Catholic University of Portugal, Sacro Cuore University, Italy, and Ramon Llull University, Spain. During the seminar, it will be available simultaneous translation from English into Spanish. If you need the translation, please feel free to enter the correct room pressing the globe that is at the bottom of the screen. Also, feel free to include and start thinking your questions and comments during the presentation in the Zoom chat. We will be collecting them during the presentation and will pass them to our panelists at the end of the webinar during the Q&A section. Our plan for today, we will start with Philip Landrigan, and then we will move on to listen to the presentation of Andrea Vicini, Edoardo Puglisi, and Straif. After that, we will have about 15 minutes for question and answers. I will introduce each of them once they start their presentations. By now, we welcome to Philip Landrigan, who is a pediatrician and epidemiologist. He directs the program for global public health and the common good at Boston College. His research examines the impact on children's health of toxic environmental hazards, and more recently has expanded to examine planetary threat to children's health, climate change, pollution, and biodiversity loss. Dr. Landrigan co-chaired the Lancet Commission on Pollution and Health, which reported that pollution causes 9 million deaths annually, and that pollution prevention is feasible and highly cost-effective. Since 2019, he has led the Monaco Commission on Human Health and Ocean Pollution. He is a member of the US National Academy of Medicine. Philip, welcome to our webinar. Thank you for joining us today. You can start your presentation now.
Rocio, thank you. What a lovely invitation, and it's a joy to be here with all of you and with such good colleagues on the panel. So let me start my screen sharing. Okay, is that right now? Is that displaying? That's correct. Okay, thank you very much. So this is my topic.
We don't see anything, I think.
You're not seeing
anything? We cannot see it. No.
It's a pleasure seeing you, but the slides may also be interesting.
Oh, good, thank you. Wait a minute, let me start again.
Yeah.
Okay. Now
it's working.
Good.
Yeah, now it should work.
Good.
Perfect. Thank you.
Is that perfect, or are the slides backwards?
Not backwards, but in presentation mode. So we see.
Okay,
both.
so let me swap it. How's that now?
Perfect.
Much better. Yeah, perfect.
Excellent. All right, thank you. So I'm going to talk about pollution and global health. I'll say a few words about pollution in general, but mostly I'll talk about chemical and plastic pollution. let me make 2 points right at the beginning here before I get into the details. The first is that when we talk about any of these planetary crises, climate change, pollution, biodiversity loss, any of them, it's very important to think about the impacts on human health. And I say that for several reasons. First of all, as a medical doctor, as are Dr. Vicini and Dr. Straif, as a medical doctor, I'm always concerned to know what impacts these planetary threats are having on people's health. But also, I believe it's very important to emphasize health when we're conveying this information to the general public and to policymakers. If we talk only about molecules in the upper atmosphere or the pH of the oceans, it's very abstract. And for most people, for most policymakers, it doesn't give them anything tangible that they can hold in their hands. On the other hand, if we talk about health impacts, especially impacts on the health of children, then we present people something tangible. It takes the abstract, it makes it concrete. So those are the themes I want to pursue as I go through this little talk today with you. So let's talk about chemical and plastic pollution. And let's start by reminding ourselves, what is plastic? Because I don't think everybody knows. I mean, everybody knows what plastic is, right? We use it every day, but what's inside of it? What's it made out of? Well, basically, all plastic has a backbone consisting of carbon-carbon bonds. You can think of it like a lattice or a skeleton that holds the plastic together. And here are the carbon-carbon bonds right there. Then, additionally, a whole series of different chemicals are added into the plastic to give it properties, to make it soft, to make it flame resistant, to make it, excuse me, to make it resistant to water. And these molecules are popped in. They're not chemically attached to the skeleton. They're just stuck in there. And there are a lot of them, as much as 50% of the weight of plastic products can be made up of these materials. So plastic manufacture really began after World War II. There was a little bit before the war. There were a few plastic products used during the war, but it was really in the early 1950s that plastic production really took off. And as you can see from this slide, plastic production was hailed as just the best thing that had ever happened to humankind. Here's an article from Life magazine, which praised the joys of throwaway living, disposable items that cut down household chores. The objects flying in this picture would take 40 hours to clean, but no housewife need bother because they're all meant to be thrown away after use. What a wonderful concept. Use it, throw it away, forget about it. Well, in 1955, that wasn't too big a deal because plastic production was just beginning. But today, it's a very big problem, and that's what we'll talk about. So here are some statistics. Since 1950, more than 8,300 million tons of plastic have been produced. With something like 7 billion people on the earth, this is more than 1 ton for every person. 98% of it is made from fossil fuels, oil, gas, coal. Those additives that are stuck into plastic, many of them are highly toxic, cancer-causing chemicals, neurotoxicants, endocrine disruptors. Production is growing very, very rapidly, and it's on track to double by 2040 and triple by 2060. And the biggest increase is in the manufacture of single-use plastics, things like wrapping, surgical gowns, stuff like that, that's used once and then discarded. Plastic manufacture is responsible right now for about 4-5% of greenhouse gas emissions, but it's on track to get up to more than 20% by 2050. And 20 million tons are thrown away, discarded into the environment every year. Here is a graph showing plastic production. Back in 1955, it was 1.7 million tons. There's the happy little man throwing plastic objects up in the air. And then here in 2022, it's more than 400 million tons. And like this picture here, we have beaches that are littered with plastic bottles, especially in the developing countries of the world. And let's talk about manufactured chemicals, because after all, plastics are a form of chemical, and we have to consider plastics and chemicals together because they go together in consumer products. So it's estimated that today there are more than 300,000 artificial chemicals on the earth. These are new materials like plastic. They're made from oil and gas. They didn't exist before 1950. They are widely disseminated in the environment. Like plastic, production is increasing. Here's a graph showing the increase, and it's on track to double. Production is on track to double by about 2040, 2045. This is what happens with new chemicals. They're brought to the market with enormous enthusiasm. Here's an advertisement from DuPont from the 1950s saying that the best things in life come in cellophane. They obviously had some different ideas back then about reproductive biology. And here's another example of a chemical that was thought to be almost divine in its importance, DDT, used to control mosquitoes, and another example of synthetic chemicals. But what happens is that these chemicals are brought to market with almost no testing for safety, no testing for toxicity. They're put into products. They then leak into the environment. They get into people. These chemicals are found in the bodies of most people in the world today. And then years after their introduction, even decades, they're found to have caused great harm to human health and to the Earth's environment. Worth taking a minute to reflect on how are chemicals and plastics and climate change, how are they all connected? Well, they all come from fossil carbon, coal, oil, gas. When you burn fossil carbon, that, of course, is the main source of climate change. But fossil fuel combustion is also the main source of air pollution, and it's the main source of plastic. And it all ties together. And all of these problems really trace back. The common root cause of all of them is fossil fuels. And if you want to go deeper, as Andrea will undoubtedly do, you'll say that at a moral level, the root cause is an obsession with profits and short-term gain, and a lack of concern for human health or planetary health. So something that we all need to be aware of when we're thinking about plastics and chemicals is that there is a big switch. We're right in the middle today of a big switch in the fossil fuel industry. They are moving away from producing fuel for vehicles, for heating, for the generation of electricity, and they're turning their carbon into plastics and petrochemicals. And there's two factors. Firstly, in the world today, we have an enormous expansion in oil and gas production. The producers are sitting on a glut of oil and gas that they've pulled out of the ground, and they're looking for markets for this stuff. And then secondly, the market to burn this fossil carbon is going down. The world is slowly moving to green energy, not as fast as I would like, but it's going in that direction. Exxon and Petro Brazil and the others can see this. And so they're taking their fossil carbon and they're switching it over into petrochemicals. And it's this switch which is pushing the great increase in plastic production. And a term you need to become familiar with, because it's going to be, you're going to hear more about this in the years ahead, are what are called cracker plants. These are chemical facilities that catalyze, cracking means catalysis. They catalyze the transformation of methane and ethane in the natural gas into the building blocks of plastic. And here's just a quick graph showing the great increase in gas and oil production, especially gas, since 2008. And here's a picture of an ethane cracker plant. These are truly enormous facilities. This is one in the United States near the city of Pittsburgh. I understand that the cost of this facility is $6 billion US, enormously expensive. And it will receive gas by way of a pipeline and convert the gas into the building blocks of plastic. It's also important to note the social justice dimension of this infrastructure. Almost always these facilities, you can see the facility in the background here, are built in the neighborhood of poor houses, low income, minority people, marginalized populations. So what are the health consequences of this uncontrolled production of chemicals and plastics? Well, firstly, the environment has been badly damaged. Excuse me a minute. Can you close the door here? Arub, can you close the door? I'm teaching. First of all, the environment has been badly damaged by plastic. This was a report we produced a couple of years ago with the support of Prince Albert of Monaco's foundation. 8 to 12 tons of plastic waste go into the ocean every year. They break down into microplastic particles that contain all of the chemicals that are added to plastic. I think of them as little microscopic Trojan horses. And they contaminate the ocean, they get into the food chain, and then we can eat them. So here are macroplastics, fish nets, plastic bottles that kill fish and turtles and whales. Here's another dimension of plastic and chemical pollution, and this has to do with planetary boundaries. So a Swedish scientist named Johan Rockström developed the concept that there are planetary boundaries. Think of the spaceship Earth. In order for humanity to survive on Earth, we have to have enough oxygen in the air, enough water to drink, enough soil to grow our crops, and so on. And he developed this graph listing around the circumference, the planetary boundaries. The climate change is in here. We have to have the right temperature, not too hot, not too cold. And when Rockström developed this concept 12 years ago, he said at that time that we were already in trouble for biodiversity loss, already in trouble for nitrogen pollution, approaching trouble, but not yet crossing the boundary on climate change. And at that time, they did not put in an estimate for chemical pollution because they felt at that time they did not know enough about it. But that has changed since then. And just a few months ago, they published an updated analysis in which they are concerned that chemical and plastic pollution are rapidly approaching a point where they exceed the planetary boundary and could threaten the sustainability of modern societies. So this is a problem that is growing very rapidly, even while we're focusing on other aspects of the planetary crisis. What are some of the health consequences? Well, and the environmental consequences. Well, DDT almost caused the extinction of the great predatory birds like eagles. Chlorofluorocarbons, Mario Molina's work, almost destroyed the stratospheric ozone layer that protects us against ultraviolet radiation. PCBs contaminate rivers and lakes around the world. And the perfluorocarbons, PFAS, are just beginning to be recognized as contaminants of groundwater very widely. What about human health? Well, we know that human exposure is almost universal. In the USA, the CDC has a national biomonitoring survey. They go across the country every year. They take blood and urine samples from hundreds of North Americans. They test that for chemicals, and they routinely find 200 or 300 synthetic chemicals in everyone, including pregnant women, including newborn babies. And most of these chemicals, as I mentioned already, have never been tested for safety or toxicity. We know that infants and children are especially vulnerable to these chemicals, and there are several reasons for this vulnerability. Firstly, children are more heavily exposed pound for pound of body weight because they breathe more air, they drink more water, they eat more food per kilogram of body weight. Also, children do things like put their hands in their mouths, roll around on the floor, which most of us don't do, not most of the time anyway. So they're more heavily exposed, and then they're biologically more vulnerable. Their organ systems are growing and developing. Those developmental processes are very, very complex. And because they're so complex, they're easily disrupted. Kids have less ability to detoxify and excrete chemicals. And then finally, of course, young children have, hopefully, God willing, a long life ahead of them. And we now understand that many chronic diseases, heart disease, lung disease, diabetes, even dementia, cancer, are the consequence of multi-stage processes that play out over many decades. And if those multi-stage processes are initiated early in life, then the risk of developing chronic disease in the middle of life increases. And all of this has led us to develop the phrase that children are not little adults. A lot of evidence now that manufactured chemicals cause disease in children, and many of these chemicals are used, among other things, for plastic additives. So we know that several chemicals, notably benzene, DES, pesticides, cause leukemia in children. Aspartame, the artificial sweetener, causes cancer in animals and likely poses a risk to humans, although not yet determined. Then, of course, there are various problems going on with male reproduction, and evidence is building that endocrine disrupting chemicals like DDT, phthalates, and bisphenol A are involved in falling sperm counts, decreasing fertility, and these other reproductive problems. The human brain is exquisitely sensitive to toxic chemicals, much more than the adult brain. And the developing brain, especially the brain of the fetus, the brain of the unborn child, during the 9 months of pregnancy can be damaged by toxic chemicals at tiny levels, at very, very small levels that would mean nothing to an adult. We've learned through hard experience, through bitter experience, that there really are no safe thresholds for exposure to toxic chemicals in early life. That obviously heavier exposure is worse, but any degree of toxicity whatsoever, any degree of exposure whatsoever causes toxic effects. There's no safe level. The brain damage caused by toxic exposures is permanent. It's mostly untreatable. And therefore, the only rational treatment is to prevent exposure in the first place. We now have a number of chemicals that we have learned through epidemiologic studies cause brain damage. And I particularly direct your attention to phthalates, bisphenol A, polybrominated diphenyls, all of which are used as plastic additives. And it's a bit like an iceberg. There are a few chemicals at the top of the iceberg that we know cause neurodevelopmental injury in children. There's a couple of hundred more that we suspect might be toxic. And then there are thousands of chemicals out there that are completely untested. And that brings up the question, are there other neurotoxic chemicals that are damaging children that we simply have not yet discovered? And the answer is, of course, we don't know. So that's the bad news. The good news, and I think this is cause for hope. And I think this is a message that we in SACRU need to put out to the world, is that these changes that I've been describing are not inevitable. Chemical and plastic pollution can be prevented. Climate change can be mitigated. All of these problems are the consequence of human behavior. And so the secret to solving these problems is quite simply, not easy, but simple, is to change that behavior. And I think the best argument that pollution can be prevented is to point to the experience of the countries around the world that are already preventing pollution and saving lives. They've passed laws, they've developed policies, they do monitoring, and economic studies have shown that pollution control is highly cost effective. So here's a graph showing the experience in the USA since 1970. 1970 is when we passed our Clean Air Act in the US. And since that time, this line here that I'm tracing on the screen, since that time, air pollution emissions in the USA have fallen by 74%. It's really an extraordinary triumph of public health that doesn't get the recognition that it deserves. But at the same time, if you look at this green line going up here to the top, at the same time, which is the GDP, the gross domestic product, the GDP grew by 250% while air pollution was going down. And so this, we've all heard people say, we've all heard politicians say, oh, you can't control pollution, you can't clean up the environment, it'll kill the economy, it'll destroy jobs. It's simply not true. Pollution control is cost effective, and it's cost effective because it makes people healthier. It makes people more economically productive because they're healthier and they live longer. So it avoids healthcare costs and it increases economic productivity. And that's been shown time and again in country after country. So going forward, what we need is a more rational chemical policy. Chemicals need to be tested before they come onto the market. We can no longer allow our children to be the experimental animals in the vast experiment that the chemical industry is conducting. And we need to take interventions against plastic, eliminate unnecessary uses, especially single-use plastic. Plastic manufacturers need to take extended financial responsibility. And in the USA, the state of California, which always leads the USA in environmental laws, has recently passed a law requiring that plastic manufacturers have to buy back the plastic they produce. In other words, no longer will people be able to throw it away. If they throw it away, the plastic manufacturers will pay a penalty. And we just need to strengthen regulations across the board. And finally, very hopefully, the United Nations, specifically the UN Environment Program, now has a plan on the table to develop a global treaty on plastics. A resolution was passed last year. Deliberations will occur later this year in Uruguay and Montevideo. I want to close by pointing out that plastic recycling just does not work. Only about 10% of plastic is recycled, a far lower percentage than paper or glass. And the reason it can't be recycled, it's not that people don't want to. I think many people are very conscientious about putting plastic bottles in the proper bin at their university, at their hospital. But the problem is it's so chemically complex, the recycling industry can't deal with it. So they do three things with it. Either they burn it, which creates air pollution. They bury it in landfills where future generations will have to face it, or they put it on a boat and send it to places like Indonesia, Malaysia, Ghana, poor countries around the world, where it accumulates on beaches like this. And how in the world can people over there live with this kind of pollution, which is our gift to them? And we need to get the word out like we're doing now. We need to communicate. We need to let people know that it's a crisis. And to accomplish this goal, we have formed something called the Minderoo Monaco Commission on Plastics and Human Health. Andrea Vicini and I are both members of this group. And it's made up of scientists and policymakers from around the world. We're coordinating it at Boston College. And the goal is to look at the hazards of plastic across its entire life cycle, develop information, give that information to policymakers, journalists, the public, and catalyze action to protect human health. And we're going to release this report in Monaco next March under the sponsorship of Prince Albert of Monaco. And the ultimate goal here is to protect the earth, which of course Pope Francis has reminded us is our common home, and to preserve this planet for our children, for our grandchildren, and the generations who are still to come. Thank you, and remember all that we are the stewards of this earth, and we hold it in trust for our children. So thanks very much.
Thank you so much, Professor Landrigan, for your wonderful presentation, eye-opening presentation. Let me introduce our next speaker, Father Andrea Vicini. At Boston College, the Jesuits, Andrea Vicini is chair of the theology department. He is Michael P. Warch Professor of Bioethics and Professor of Theological Ethics. He's an alumnus of Boston College. Professor Vicini also holds an MD and a specialization in pediatrics from the University of Bologna and an STD from the Pontifical Faculty of Theology of Southern Italy in Naples. He is co-chair of the International Network Catholic Theological Ethics in the World Church. His research interests and publications include theological bioethics, global public health, new biotechnologies, environmental issues, and fundamental theological ethics. Professor Vicini, welcome and thank you for being with us today. The floor is yours. You can start.
Thank you very much, Rocio, for your very generous introduction. And also thank you to Romano Guridi for organizing our webinar this morning, and Professor Landrigan for his presentation. I want to focus my reflections on the ethical urgency of addressing global plastic pollution in the world today. With this presentation, Professor Landrigan aimed at raising our awareness in identifying the gravity of plastic pollution globally, with its historical, political, and economic causes, and stressing our strategies to address this crisis are available and feasible. Among ethicists, his concerns are shared, and they are framed in terms of humankind's responsibility in claiming and promoting a greater social justice and advancing global health. Hence, I respond to Professor Landrigan's call to responsible action by focusing first on social and environmental justice, and second, on global health. So first, social and environmental justice. Social and environmental justice are both urgent and demanding. First, the urgency depends on the need to address the dire inequities that affect the lives of people and countries and the whole planet. These inequities inhibit personal and social flourishing. Concretely, Social justice demands to consider why plastic is produced, which resources are needed to obtain plastic products, which market forces lead to both the production and the consumption of plastic, for example, the use of bottled water and single-use plastic containers. Who influences and controls these chains of production and these social dynamics, as well as who and what suffers because of these choices, from people, particularly minorities in the Global South, to the land, oceans, and air, where plastic products and their derivatives accumulate by negatively affecting all forms of life and ecosystems, as Professor Landrigan just showed us. Second, urgency needs to be reinforced with the fact that social and environmental justice are demanding endeavors because they require to consider how human beings behave by focusing on human agency and on people's choices, and by examining what happens in society. Critical analysis, which points to injustices and inequities by recognizing and naming them, should lead to social transformation. Changes should aim at addressing the plastic pollution that the planet is experiencing by reducing the production of plastic and its consumption, and by expanding alternative, recyclable, and compostable alternative products. However, any type of change is hard and faces predictable resistance because of the interests involved. Acquired privileges and power, whether in the case of individuals, groups, organizations, or multinational corporations, will resist any change, trying to undermine them. Hence, any attempt to promote greater justice that involves examining critically the production and use of plastic products will face resistance and even opposition. Within the social fabric, changing the status quo is perceived by many as highly problematic and the cause of social instability. But change is needed to address blatant and horrifying inequities that affect people's health and the quality of life on Earth. Change is required to protect the health of all people, from the children to the elderly and on the whole planet. To address both the urgency and complexity of promoting social and environmental justice in dealing with the pollution caused by plastic, the ethical tradition trusts the human ability to address these ethical challenges and invites all moral agents to be concerned about those who are more vulnerable in our midst by making a preferential option for those who are less advantaged, marginalized and excluded. The preferential option for the poor implies and requires the empowerment of those who suffer from forms of economic development that foster inequities by joining them in transforming unjust situations. Hence, the preferential option for the poor is also a preferential option with the poor, and it implies accompaniment. It is a shared endeavor. Humankind has the ability of addressing the multi-layered crisis caused by plastic pollution in diverse ways. For example, by regulating and monitoring the toxic compounds that are used in producing plastic, as Professor Landrigan described, by assessing what plastic and these chemical compounds cause to human and planetary health, by intervening with strict protective measures and modifying productive pathways. Because social justice aims at addressing any inequity by removing them and by promoting greater equality that contributes to personal and social flourishing. Social justice critically assesses what society produces, who benefits from it, who has access to it, who is left out, and what is not considered. To say it differently, we could ask, who is not seen? Who is voiceless and is not heard? Who and what suffers from the ongoing plastic pollution? The tragic history of racial discrimination has alerted humankind on the need of a continued vigilance on any exclusionary process, on our tragic ability to consider some people in our midst as deserving respect and being worthy of dignity, regardless of their background and status, and demanding to have a chance of living healthy lives. Global, social, and environmental problems like those caused by plastic production and consumption, and the consequent pollution that they cause, invite people of goodwill to consider whether specific forms of global governance are needed, and in that case, which model of governance could be appropriate. Many proposals have been debated, from the leading role of one nation, some have suggested the US should be a leading nation in this endeavor, to more complex proposals that engage multiple social actors, nationally and internationally, by affirming their role in monitoring chemicals as well as plastic production, consumption, and disposal. Any easy solution to the issue of global governance at the moment eludes us. Not binding agreements or treaties are important, but they do not provide yet the required forms of accountability for those who violate those treaties. Hence, striving to define ways to articulate global governance stands at the moment as an unresolved challenge. Locally, one can identify encouraging initiatives of individuals and communities. Moreover, networking seems to be important and promising in addressing social and environmental global challenges. Networking allows collaborative engagements, monitoring, and interventions that depend on the networking of multiple social agents, for example, citizens, groups, non-governmental organizations, nations, and international organizations. An example could be the collaborative commitment to clean the Great Pacific Garbage Patch, with its huge accumulation of plastic in that area of the ocean. Another example is the promotional campaigns to limit the production and use of plastic products, from plastic bags to plastic coffee straws, that could be replaced by recyclable and environmentally sustainable alternatives. Finally, one could mention forms of consumption that reduce plastic use, for example, water fountains and clean tap water to reduce the need of single-use plastic bottles. Now, I end by focusing on a second area of interest, that is global health, understood as a common good of humankind. Plastic pollution is affecting health on a global scale in ways that compromise the current generations as well as future generations, with the risk of lasting effects that one might be unable to recognize and quantify accurately, as Professor Landrigan showed moments ago. At the core of any reflection regarding global health is the profound conviction tested by everyone's experience, for example, during the recent global pandemic, that health is a precious good for both for human beings and the whole planet. Moreover, health is a shared common good that concerns anyone and everything. However, health is a fragile and vulnerable good that demands care by examining who lacks health, by asking why people are not healthy, by investigating what affects their well-being and flourishing, and by implementing what aims at restoring health as much as possible for populations, the whole humankind, and the planet. Because health is such a good, an ethical commitment to promote health is again urgent and demanding. By considering the multiple ways in which the production, use, consumption, and disposal of plastic is affecting health, it is urgent to stop relying on the types of plastic that humankind is using now, and we need to clean up the planet without delay. Of course, this is a demanding task, but it is within the scope of our human abilities. Such a demanding endeavor requires to promote concrete ways in which humankind shows its commitment to foster global health by making available primary care across the planet, as well as more advanced healthcare services. The commitment of nations, international agencies, organizations, and people of goodwill is needed. By engaging both individuals and groups, it will be possible to address the challenge of global plastic pollution and foster the common good of health. To promote personal and social flourishing, humankind depends on ingenuity, shared individual and communal capacities, and on a renewed ethical commitment. Our conversation today contributes to this engagement. Thank you for this opportunity.
Thank you, Father Vicini, for your interesting response. Before continuing, I would like to remind to those participating in the webinar to include your questions or comment in the Zoom chat during the presentations. We will be collecting them and pass them to the speakers at the end of the webinar for the Q&A section. So feel free to just write there once you have a question or comment. Our next speaker is Edoardo Puglisi. Professor Puglisi is an associate professor of agricultural microbiology at the Università Cattolica del Sacro Cuore, Piacenza, Italy. Author of more than 100 papers indexed in Scopus. He is also leading a research group on the microbial ecology of food, soil, rhizosphere, and polluted environments, with a strong focus in the last years on the risk assessment of micro and nanoplastic on the agri-food systems. Among different projects, he is the responsible for Università Cattolica del Sacro Cuore of the EU Horizon project MINAGRIS, micro and nanoplastic in agricultural soils, sources, environmental faith, and impact on ecosystem services and overall sustainability. Professor Puglisi, welcome and thank you so much for joining us today. You can start your presentation now.
Thanks a lot, Rossio. Thanks to the SACRU for the organization of this really important seminar on this topic. I'm now sharing my screen and going in full presentation, which should be okay. And I will present you some data regarding mostly the research we are carrying out in Università Cattolica on the issue of plastic. We are an agriculture faculty, so we have quite a focus on the agro-food sector, on soil and food, but we will also see some little links also on the toxicology of plastics, okay? So this is a small outline of what we're going to talk, some general features. Of course, this is going to be fast. I will talk a little bit, of course, in an accessible, simple as possible way about how plastics are shaping the microorganisms in the soil and why this is important, how we can also find degrading microorganisms. Then I will move about bioplastic, and this is a link, of course, to the lectures that have been made before, because of course we need alternatives. We already have some good alternatives, but then there is still need some improvement according to the research. Then I will just mention aquatic environments and impact on the organism, and a little link to the MINAGRIS Horizon project that you mentioned before. I will not go into details. We already had a great presentation about the plastic types. I will just make this scheme because it's quite relevant to understand that we have fossil-based and biological-based plastics, and we have plastics and bioplastics. And this is a little bit confusing because at the moment we term bioplastics the ones which are either bio-based or degradable. Okay, this means that you can have, for example, biological polyethylene. This means that it's coming from a renewable research source, but it's polyethylene in any case. Okay, so its characteristic is the same or the fossil-based. And then we got the biodegradable one, which can come from both origins, and these are supposed usually are quite degradable, but there is a lot of relevance on how this is being carried out. Of course, we care about plastics, and this is very related to the health, because now we know quite well that they can fragment, making micro and even nanoplastics. And the big problem with nanoplastic is that we are learning more and more the fact that the smaller they are, the more they are biologically active. So indeed, there are possible health problems related to the micro and nanoplastic, although this is still under research. So the World Health Organization, for example, just released a document 1 month ago where they basically claim that the need to do more research. And this is, of course, a good thing, because we need solid evidence about the potential effect, even if some, let's say, first indication about this are there. Okay, so we'll start presenting some of the results we got. We started working with plastic also with Professor Concelli, who is the secretary of the SACRU, by looking at what was happening in all fields. So we went a few years ago to a field quite close to Piacenza and Parma, which is this abandoned field where you can see a lot of plastic. This used to be a former landfill. You can find several plastic still there after 20 years. And so we are interested to look at the microorganisms. I'm a microbiologist. We know that microorganisms play a fundamental role for the soil health, for the degradation. And so we look on these different color plastic about the situation. These are some of the results. Of course, I will not go into technical details because this is not the place to talk about. But basically, we are able to see that the different plastic of different colors had very different microbial communities. And we could also see that some plastic were more degraded than the others. And the microbial community was also changing in this kind of plastic. So, for example, we got this red color plastic who had a bigger degradation and had also a higher diversity. So the main point here is that there are several microorganisms, bacteria and fungi, that like living on the plastic. We call these microorganisms in general plastisphere, and some of this plastisphere can have a role in degradation. So the next step of this research was about isolating interesting bacteria and fungi from this landfill site and see if they could degrade. So here, for example, you see evidence from one of our publications about fungi we have been isolating and their ability to degrade plastics. And this is, for example, what we see here. You can compare, okay, once again, not need of big details, but what, for example, you can see here that this is polyethylene. We try to degrade polyethylene as compared to the control, which is in black. We can find some peaks that basically are indicating that our bacteria or fungi are degrading the plastics. The main point here, talking about polyethylene, which is one of the most widespread plastic and is considered non-degradable, is that these bacteria and fungi are carrying out a very partial degradation. We talk about 5–10%. This means that there is a lot of research to be done, hopefully, to improve this degradation process that some microorganisms are able to do. The next line of research we carried out in our group was related indeed to the bioplastics. And the point about bioplastic is that if you look at this number from the European Bioplastic Organization, these are increasing a lot, okay? Not only the biological polyethylene, the biopolyethylene I told before, but also the biodegradable material, which are the ones, for example, now in Europe, we are using more and more. And so these are increasing a lot. They are used as substitutes for a single-use plastic. And this is indeed a very good choice, I think, because as we heard before, we can do recycling. Of course, we can improve it, but we need alternatives, and it's good to find alternative. I mean, a non-degradable plastic is okay, in my view, for a car or for some durable material, but not for something that you make single use. So the promise, the possibility we have, sorry, there's one slide more here about this material, is that this material could help us to reach what we call a real circular economy. So to have a system like this is again from European Bioplastic, where we make this material from renewable resources, and then we use them, we reuse them sometimes, and then we reach a complete biodegradation. The point about biodegradation, this is a number of papers we are publishing with my group, especially my collaborator Francesca Bandini, who did a PhD on this topic, was indeed about what is happening to this material. At the moment in Italy, we have what we call the organic fraction of the waste, which is the one usually we separate for recycling. And we've got materials, bags, but also forks, glasses, and so on, that are made of biodegradable bioplastic. The issue we outlined with a serious paper we've been publishing is that these materials have been labeled compostable according to certain conditions. And these conditions, under this condition, they are absolutely degradable and compostable. But the problem we are facing is that many plants that are treating industrially these materials, they are not following this condition because they are very long, so they're very costly. So there is an issue about cost and technological solutions. And so some of the data I'm showing here, of course, I will not go into details, are indicating that we got still a quite a high percentage of residues, and also that the compost we obtain, if they're not long enough time for anaerobic digestion and composting, which means first you make methane energy and then you make compost for agriculture, you got residues, and you can have also a compost that is no good for the growth of the plant. So this is another example of the upscale we made, once again, under the industrial condition, and you can see how in the final compost you can still find these bioplastics. And these bioplastics can affect, for example, the germination of plants if they're still there. And also this is okay, I don't need to go into the details about this, but basically we also found that all the microbial communities involved in the anaerobic digestion and the composting are affected by the plastic and the bioplastic we got in the system. Okay, just a few slides more, then I'm going to be finished. I don't want to give too much data. This is about little research about impact in aquatic environments, because we are now caring in the last years about terrestrial environments, but in the past, the main issue, and still now, of course, is about aquatic environments. So, for example, we have been looking to see if plastic and biodegradable plastic, how do they behave in the aquatic environment? And for example, we could see, according to this data, how both plastics and bioplastic can harbor in sea and in other aquatic environments very complex microbial communities. And they have got a very good capacity to form what we call a biofilm, so a group of microorganisms. These indeed are pictures we have taken in our laboratories with an electronic microscope, and you can see how the different bacteria are being formed in a few days on the surface of the plastic. So the next question, which was related to this, was what is this impact about the plastic? Because also from the keynote at the beginning, we've heard that one issue of the plastic is related not only to the plastic itself, but to the fact that it can carry pollutants such as pesticides and other pollutants, but also microorganisms, as we know. So we can have eventually some pathogenic microorganisms that are on the plastic surface. So thanks to a collaboration with some friends and colleagues from Tunisia, we carried out this study in different locations from the north of Tunisia, where there was a sampling of plastics. So these are real environmental plastic. And you can see here some data about the sampling locations, the different type of plastic we got, polyethylene, polyethylene terephthalate, polypropylene, and so on the different sites. The differentiation in size, and this is relevant because as you can see, these are number of items that were found, okay, in percentage. And we also see there is quite a relevant percentage of items below the millimeter for the micrometer, and most probably also to the nanometer. So the smaller they are, the most biologically active they are. And then we were looking at muscles, okay? And here you see the data about the number of plastic items that we found in the tissues of the muscles. The point here is that, of course, now plastics, micro and nanoplastic, are ubiquitous, okay? There are no food actually that are free of micro and nanoplastics. But of course, as the World Health Organization is saying, we need to understand better what is going on. In the case of this studies, basically what we did was about looking how these microplastics in the muscles were affecting, on one side, the toxicology of the muscles. And for example, here you can find on the bottom some results about a strong induction of genes that are related to stress response. So we know very well also on human cells that we got this response. And then we found a change of the microorganism in the muscles and on the plastics induced by the plastic. Okay, so this is another line of research that we have also been carrying out, and we are still, I would say, very active at the moment because we have got several experiments going on about the impact. You see here a scheme of what's going on in the agriculture system with the plastics, and the fact that, for example, micro and nanoplastic can affect also the soil fauna. And the soil fauna, we know that is very important for the quality of soil because there's many ecological services that are related to. And now we have got, these are unpublished data because we are now writing the manuscript. And basically what we see, just to make a summary, these are experiments about the impact on seaworms, so water environment once again, and sediments, and earthworms. And we looked at the microbiome of these species, looking at both at bacteria, fungi, and archaea as well. And what we could see is that there was a strong impact in terms of change in the microbiome of all these animals on the gut microbiome when they were exposed to plastic. And the same thing, of course, we are seeing for humans. Regarding this data, we have to be, and in the second part, we also have an evidence with the synergy with pesticides. I'm coming to the conclusions, this is 10 minutes. And regarding this data anyway, we have to be very careful in stating that to see a change is not necessarily a detrimental effect. We see that something is changing. The relevance of this needs to be addressed. I will just finish to mention this project that we started 1 year ago. It's a big project coordinated by the University of Wageningen. We are like 19 partners. We're going to work for 5 years. We're going to look indeed from many points of view about the impact of micro and nanoplastic in agricultural soils from different dimensions. And we have several, we've got basically 11 case studies of agricultural soils where we're going to look at the impact of the plastics. This is some information from the website. So just to come to the conclusion, what is emerging today also from the other lectures that we have been considering for many years plastic as something completely inert, not to care about. But now we know that biologically active. We first study aquatic environments, now we work on terrestrial environments. When we look at the so-called plastisphere, that for us microbiologists is the, let's say, the plastic-loving bacteria and fungi, because they live indeed and they stay there, is very interesting for exploitation. We need to learn more about how to degrade the plastic. And I believe as a microbiologist that there is space to discover new pathways and maybe to exploit them, maybe also with the new genetic tools that could be allowed in the next years. We need to do research on bioplastic because they are valuable, but we need to implement them. There is a problem related to the accumulation in organisms, including humans. I'm not, of course, a doctor, so I'm not talking too much about this, but we know that in our bodies we have plastics. We have even in the placenta. And of course, we need strong interdisciplinary networks. And SACRU, of course, is a great opportunity to do this. Okay. And thus, sorry, this is a lot of acknowledgement I need to do, starting from my group, other group in my university, colleagues in Tunisia, in the Netherlands, in Greece, and so on. So there is quite a strong network working on this topic. Thanks.
Thank you so much, Professor Puglisi, for the wonderful presentation. Our next speaker, the last but not the least speaker, is Kurt Straif. Professor Straif was long-term head of the section of evidence, synthesis and classification at the International Agency for Research on Cancer of the World Health Organization, Lyon, France. Since his retirement from the World Health Organization, he works as a research professor at Boston College and as an associate researcher at IS Global Barcelona, Spain. He co-authored more than 250 scientific papers and was editor and associate editor of several books, including World Cancer Reports, Air Pollution and Cancer, Social Inequalities in Cancer. He studied medicine, epidemiology, public health, and philosophy in Europe and in the United States, and is board certified in internal medicine and in occupational, environmental, and social medicine. Professor Straif, welcome, and thank you so much for being with us today. You can start your presentation now.
Thank you. Thank you for your very kind introduction. Can you see my presentation now?
Yes, we can see it.
Okay, thank you. So I have an easy task now after all these excellent speakers, and I will try to close the circle and focus a little bit on where Phil Landrigan started with pollution and global health, with a special focus on cancer, because this is my foremost expertise. So before going into cancer, let me use that introductory slide. I mean, of course, at the moment, all our minds are on the COVID pandemic. But if we think of the epidemiologic transition, we must face the problem that cancer is now the leading cause of premature death in many, many countries, including high but also middle income countries. You can see on this slide those countries in dark brown. Their cancer is the first leading cause of premature death. And that is together with those where it's the second leading cause, a little bit less dark brown, it's a total of 134 countries. So there's really a pandemic of cancer going on. And what can we do with this challenge of global cancer control? Well, first, it is even getting worse. It has been estimated based on data from Global Cancer Registration that there were about 18 million new cases in 2018. And based on predictions, it was estimated that there will be almost 30 million new cases by 2040. But what's even more worrisome is that the majority of this increase in cancer burden is expected to occur in low and middle income countries. And this is why one of my great directors, Dr. Chris Wilde at IARC, coined the term, no country can treat its way out of the cancer problem. And prevention, fully in line and in support what Andrea and Phil also presented, prevention is the single most effective response to these challenges. And to start with prevention, we, however, need to know what's causing cancer in humans or what works in cancer prevention. And that's where the IARC monographs and the IARC handbooks come in. And I will just give a few results from these as they're relevant to the chemical pollution as presented by Phil Landrigan. So these are some of the chemicals that he mentioned. Let's start with perhaps the mother of plastics, PVC, polyvinyl chloride, and particularly its monomer, vinyl chloride. It was already in 1967 in the US at the BF Goodrich company that first cases of an extremely rare cancer, angiosarcoma of the liver, were detected. And more and more of these very rare cancers occurred, and they notified the US NIOSH in 1974 of 10 cases. And this led to further investigations. And then amongst others, of course, the IARC monographs classified this as a group 1 carcinogen, meaning that we know it's causing cancer in humans. There's others like polychlorinated biphenyls or the organochlorines that Phil Landrigan mentioned that have been classified as 2A. That means probably carcinogenic to humans, meaning that we have very good evidence, strong evidence from cancer in experimental animals, but also support from epidemiological data. And DDT, as we know, soon after its introduction, already in the 1970s, there were data in experimental animals that showed increased cancer risk. But the epidemiology, of course, takes much longer because there is a long time from first exposure to cancer. So the epidemiology is here only a tool after the market introduction to count the deaths and analyze and make causal inference. The story continues, of course, with Phil also mentioned PFAS. IARC evaluated the PFOA as 2B, the first evaluation of one of these new class of chemicals that are perhaps as toxic as dioxins. And this was the first ever cancer classification of one of these as 2B, based on evidence from animals and from human beings. Dr. Landrigan also mentioned chemicals with neurodevelopmental disorders in children, and some of these also cause cancer. Arsenic was already evaluated in one of the first volumes of the IARC monographs in 1973, and pHs, polycyclic aromatic hydrocarbons, which are the product of every incomplete combustion of organic matter, was already described centuries ago by Sir Percival Pott in young boys' chimney sweeps that tried to clean still hot chimneys during the Industrial Revolution in England, and that came down this type of dermal cancer, scrotal cancer. So the history of these agents causing cancer really has a long, long story. And you see the corresponding books where these expert evaluations have been published on the carcinogenicity of these chemicals. I'll go a little bit deeper on one of these, and that is air pollution. And you'll see in a moment why. The IARC monographs on air pollution, this resulted from a recommendation of one of the regular external advisory groups to the monographs program in 2003. This advisory group recommended for the IARC monographs program to evaluate with high priority air pollution as a potential carcinogen. But they also realized the complexity of the topic and suggested to have a dedicated planning meeting, which was then held in 2004, and in fact recommended a whole series of monographs related to the topic of air pollution. So in volume 109, finally, after looking at other components of air pollution, the final book in this series on outdoor air pollution and also on particulate matter and outdoor air pollution was published in volume 109, where there was full consensus by the International Expert Working Group that these are causing cancer in humans, and that is particularly for lung cancer. Now, this is just identifying what's indeed causing cancer in humans, but this has been taken forward by the Global Burden of Disease project that looks at all kinds of external exposures, behavioral, environmental, occupational, but also metabolic risks, and what is known in terms of communicable and non-communicable diseases. And here you see, and if you only focus on the colors, that kind of brings a lot across the message already. You can see that the dark green, that is the indoor air pollution that started as relatively high, number 7 of all external causes of diseases as a burden of disease in the 1990 assessment, and then slowly decreased, but is still among the top agents that cause adverse health impacts globally, worldwide. And what's even more important for this indoor air pollution, this is particularly affects women in low middle income country, and the socioeconomic development is also strongly associated with exposure levels for many risks, and particularly for household air pollution. Now, if you look at the yellow highlighted part, this is ambient particulate matter, outdoor air pollution, and you can see that its importance in terms of contribution to the global burden of disease is increasing. It's in fact the #1 environmental factor in terms of adverse health outcomes from this assessment of the Global Burden of Disease project. And Phil Landrigan also already has made the connection with the climate crisis. And a recent evaluation by a systematic review by the World Health Organization, Air Quality Guidelines, was published in 2021. And we, as a group of scientists in the International Society of Environmental Epidemiology and the European Respiratory Society, wrote a commentary when these new guidelines were finally published. And we already at that time also made the clear link between the air pollution and the climate crisis. And we said that an ambitious air quality and emission reduction policy around the world would also be helping not only to reduce air pollution, but also address climate change simultaneously. This commentary was signed by well above 100 scientific societies. But there is more than just the air pollution. It's a very complex mix of different things that directly or indirectly relate to climate crisis and cancer. Beyond air pollution, there's also the indoor air pollution, of course. There's diesel engine exhaust from transport. There are the polycyclic aromatic hydrocarbons that have been mentioned. These are more obvious, but then there's, of course, also the meat consumption, because the production of meat requires deforestation, results in methane emissions. And then there's, as a protective factor, physical activity, because if we would have less private transport and instead use of public transport or bike and walk, design our cities more intelligently, this would also help the fight against the cancer pandemic, but also in terms of the climate crisis. And then, of course, pesticides, fungicides, herbicides towards a sustainable agriculture, because agriculture is also an important contributing factor to the global climate crisis. So this is trying to kind of put all of these complex interactions together in a nice iconogram from the British Medical Journal. Beyond the climate crisis, which is dealt with not very efficiently yet, but we're making progress in the follow-up of the Paris Agreement and the regular Conference of Party meetings, the next one being in November in Sharm el-Sheikh. There is also another global agreement from the United Nations. This is about the social development, sustainable development goals. And again, from an analysis of the Global Burden of Disease project, now looking into progress with regards to the sustainable development goals from 195 countries in a systematic analysis in 2017, it was concluded that many health-related SDG indicators would really require a concerted shift away from what might have driven past gains, curative interventions. In the case of NCDs, non-communicable diseases, including cancer, towards multi-sectoral, prevention-oriented policy action and investments to achieve SDG aims. In summary, several targets, if they should be met by 2030, which is the agenda of the SDG, that would demand the pace of progress that no country has achieved in the recent past. So it really requires a major turnaround. Now, there is also some hope. We have heard about the single-use plastics, and the European Commission, and particularly driven by the environment part, has come up with an ambitious timeline for the phasing out of single-use plastics. They are tackling the 10 single-use plastics that are most commonly found on Europe's beaches. And this is also promoting sustainable alternatives. Among those 10 most commonly found single-use plastics, these represent about 70% of all marine litter in the European Union. This includes single-use cutlery, plates, straws, stirrers, beverage containers, plastic bags, etc. And you see the timeline on the left. And I think without going into all the details, what's most important, if you look here in July 2021, the EU no longer allows certain single-use plastic items to be placed on the member states' market, and marking requirements enter into force. And there is more details in terms of follow-up and accountability, etc. So this is an important ambitious step towards the reduction of the plastic pollution. But there is definitely more that needs to be done, and that is my final slide. Just today, there was a publication by many well-known international journal editors including The Lancet, including a British Medical Journal, including JAMA, also including the Annals of Global Health, which is a journal that is with Phil Landrigan as the chief editor, and that's coming out of Boston College. And there was a commentary published today that urgent action is needed for Africa and the world in the context of the climate change conference. And they've, and that kind of brings us back to Andrea Vicini's great presentation. There is certainly a moral reason for that, because it's highly unjust that the most impacted nations have contributed the least to global cumulative emissions, and these are the driving the climate crisis. But there is more than the moral reasons. The acute and chronic impacts of the climate crisis create problems such as poverty, infectious diseases, forced migration, and conflict that spread through globalized systems. There is more action, and in putting health on the agenda of the global climate crisis and the chemical crisis, which are both health crises. And earlier this week, the Global Climate and Health Alliance has published their health community recommendations. And I won't go into details, but they cover the different important domains of the COP27 negotiations: loss and damage, adaptation, mitigation, and finance. And that has been supported by many health institutions internationally and nationally, and there's still time to sign on. This is sent to the Conference of Party delegations of the countries to really bring health to the forefront and to the negotiation table. I'm really looking forward to an interesting discussion, and thank you for inviting me to this interesting and important seminar.
Thank you, Professor Straif, for being with us today and sharing with us your research. We have learned and enjoyed 4 profound and challenging presentations. Unfortunately, we will not have time for Q&A section. However, be sure that we will pass the questions to our panelists so they can consider them in further presentations. We have collected them, we have those questions, but we don't have time to enjoy them or to open the discussion. Before leaving, be aware that the webinar will be uploaded to YouTube so it can be shared and watched afterward. Thank you, professors, for the wonderful presentations. Thank you, all the participants, for joining us today in the Zoom room. Have a wonderful day.
Thank you.
Thank you. Bye-bye. Thank you.
Bye-bye. Thank you.